After surgery, you have dressings on for a period of 2 weeks, and that's when the first dressing or the first wound reveal occurs. At this stage, there are often small irregularities around the wound associated with puckering from sutures, which settles promptly over the next month or so as those sutures dissolve. At 2 months, the wounds generally look beautiful. However, natural wound healing makes those wounds get pinker up until a maximum at about 4 to 6 months, at which stage it then starts to fade, but that can take a period of up to 18 months in total. At that point, we have the final outcome. One of the other issues, though, is we do want to minimise the length of the wounds, and if we take out tissue in one area, we need to run a little pleat so that we take out the looseness beside it. What often happens is we have little bumps at the end of the incision, particularly in the fold under the breast. These are called dog ears, as little bulges on the sides. The body will deal with these in general, and at 9 months, if they're not completely removed, we put local anaesthetic in and trim them out just like you would a mole. And that is an operation. It is a complication in a sense, but it is a relatively simple and elective procedure. It is the commonest reason, even though it's not common, it is the commonest reason to reoperate. About the only other reason that occurs periodically is every 18 months to 2 years, we might have someone who has some bleeding into one breast after surgery overnight, and we might have to go back to the operating room to open up the wound a little, take out the blood, resuture it, and get the healing back on track. Uncommon, but as I've said before, there aren't many regular problems associated with this operation.